you all for coming. It is a great day. Always Carol knows how to pick up those days and invite you here. My job is to find out what is good in medicine and offer it to humanity. I have been a physician for 50 years in Minneapolis, Minnesota. I used to be in open cardiac surgery, general surgery, urology. But in the meantime, I always had a question about our medicine. It is in a way very good medicine, excellent medicine for treating acute diseases like infection, like appendicitis, and it is mainly destructive because the side effect of medicine, either we take an organ or we cut a belly or we do something. I have been looking all my life for constructive medicine. Constructive medicine is a building medicine. How to repair the body, how to regenerate our degenerative status. And that's why I took a PhD in physiology to learn about stem cells. They think stem cells is something new. That's not true at all. If you have a cut in your hand, guess what? Correct your hands. How fix the wound? How heals? All are stem cells. What makes the born kid, when is one day to grow to be 22 years old, to be male or female, all are stem cells. All of us are born from one stem cell that has all the gene in one, and not only it has it, it knows where they deliver it at the time where it is needed. I kept looking for that, never found it, until I was sitting here today, and I thought, who really created all those events to make stem cell useful in America, to you, to the European, to the international? And I thought of one guy. I'm very sorry that I have to say something good about my son. Usually you don't say something about your son good, but that's when I'm sitting in the sun here, I thought of my son. And I see, I don't know where he is. I like to look and find him if I can. Where are you? Here, this is my son. I tell you what my son did. My son did something I could never do in all my life. Find a way to reach my aim after 50 years in life in medicine. He called me one day. He said, Dad, I have something for you to look at in China. I said, son, forget it. I don't deal with Chinese medicine. I don't know anything about, I don't trust the Chinese medicine. He said, Dad, this is not a Chinese medicine. This is the real McCoy. I know you worked all your life in research work in Minnesota. I'm not going to bring you for something that you really don't work with. And what happened, I said, I'll go there. So I went there. He had for me 2 patients. One had hematoma to his brain, and big hematoma. He had surgery to evacuate the hematoma, but he continued to be comatose 50 days after that. And we went to the hospital and they gave him injections of stem cells in his spinal fluid, and we left. What brought me to another case, a lady, 60 years old, who had a cerebrospinal accident to her head, a trauma to her brain, an artery was closed, and her left side was paralyzed. She couldn't stand on her foot or move her arm. And asked her to walk, couldn't walk. And all this were recorded on videos. They gave her the injection in her spinal fluid, and after a week, we went back, and I told her to walk. She walked. She stood on her foot. I had been for 50 years in medicine. I never saw that, nothing recorded like that. I looked at my son eye to eye, I said, son, if this will hold, you have the internet of medicine. Something I have been working all my life to find it, you found it for me. And thank you very much, but let us work very hard. So we reviewed the last 100 cases in the Chinese, and the Chinese at that time had 800 cases. And the thing held very nicely. I said, we are in it. So we work on it. Within the last, now, total patient in China we have, including the international, we have more than 4,000 patients treated. What is the advantage of what we are using? When you use bone marrow, you have most likely to take it from the same patient and inject it from patient, otherwise it will be rejected. The stem cells take it from umbilical cord. You don't have to take it except from a healthy born child. His cord will cut anyway, and those cells will be thrown away. We are having those cells, culturing them, growing them, fortifying them, adding the gross material to them, and we have expected that Baker has special method to do it, and they are working. The beauty of those cells, they are not rejected.